Point-of-care ultrasound can be a great asset in a resource-limited environment. So not all pediatric emergencies have readily available ultrasound services 24 hours a day, CT, MRI. So for example, the environment that I practice in at home, we have ultrasound services just for the regular day hours, and outside of that you need to make arrangements to have either the radiologist come in or the patient be transferred to another facility. CT, MRI is not on the compound, it's a 20-minute ride in the ambulance, and that in itself takes time to organize transport staff, physicians to accompany the patient, and then making arrangements at the other end to facilitate the patient care as soon as they arrive, which usually can take an hour or more to organize everything, and then have some time lag in terms of once a patient arrives at the other facility to have the investigation done. So for example, a patient presenting with abdominal pain in the middle of the night or after hours where appendicitis is suspected, being able to perform POCUS at the bedside and rule in appendicitis will be a great asset. What it does, it really will help us, one, if our surgeons are on board, we can show them the images from our machine in the Emerge, and that will be sufficient. Others would want a comprehensive ultrasound, and having seen it for ourselves in the Emerge, we can then more forcefully push for all the other services to come in on board very quickly to expedite care for the patient. Likewise, in a case-sensitive, a time-sensitive diagnosis, for example, intussusception or testicular torsion, where ultrasound is basically the gold standard for the diagnosis. Again, being able to do this at the bedside in real time will really expedite downstream care for that patient. So point-of-care ultrasound is an excellent tool, to have in your arsenal in a resource-limited environment.